Hi Fun Family! Today, February 28th, 2022 is a Rare Disease Day. So we reached out to some families in our area who have children who suffer from rare diseases, and they wanted to share their story with you. So watch along and you'll be able to see some amazing children. Tennyson, or TENS or Tenzi for short, was born with Russell-Silver syndrome and 1p36 deletion syndrome. RSS is a form of primordial dwarfism. His limbs are proportional to his body, but he is much smaller than his peers. RSS results in feeding issues, hypoglycemia, hypotonia. 1p36 is a missing piece of a chromosome that causes global delays, cardiomyopathy, seizures, and further growth disorders. When TENS was 1, he caught a common cold, which became life-threatening. While he recovered after several weeks of intubation, he was left with another rare disease, bronchitis obliterans, a progressive scarring of the lung tissue. TENS disease is further complicated by his inability to grow. Scar tissue outplaces new lung tissue. His lung disease progressed in the winter of 2020. His heart failed and he arrested for 33 minutes. Despite horrendous odds, TENS survived this code, but due to the prolonged lack of oxygen, he now has an anoxic brain injury. He lost all ability he worked hard to gain, but he kept a smile and incredible will to live. We feel so grateful to have Tenzi in our lives. He has become our family's inspiration. This video is dedicated to Victoria Lean. Victoria had systemic juvenile idiopathic arthritis, SJIA, is a systematic and auto-inflammatory disease. In adults, it's called Still's disease. SJIA is a rare type of arthritis that causes inflammation. Despite the word arthritis, not all kids have joint movement. It is called systemic because it can affect many parts of the body, including the organs. The cause of SJIA is unknown. There is no cure, but its symptoms and prolonged complications can often be controlled over time with medications such as biologics and steroids. Some kids are fortunate enough to go into remission, while others struggle for years, and the less fortunate succumb to the complications of the disease. My daughter is one of the less fortunate ones, whose life ended with complications that came from a lung disease that was likely caused from one of the biologics that was used to control the SJIA from flaring. They think that her biologic is what caused her lung disease. The biologics webpage can even list ILD, interstitial lung disease, as a possible serious side effect. This led to scar tissue in her lungs and eventually got so bad that the scar tissue started compressing her pulmonary artery, which led to pulmonary hypertension. The pulmonary hypertension led to right-sided heart failure, which also caused her cirrhosis of the liver and then ascites. Victoria passed away on June 23rd, 2021. CHARGE syndrome is a recognizable genetic syndrome with a known pattern of features. It is an extremely complex syndrome involving extensive medical and physical disabilities that differ from child to child. CHARGE syndrome is correlated with genetic mutation to CHD7, and the prevalence of CHARGE syndrome is 1 in 10,000 to 115,000 live births. Babies with CHARGE syndrome are often born with life-threatening birth defects. They spend many months in the hospital and undergo many surgeries and other treatments. Swallowing and breathing problems make life difficult when they come home. Most have hearing loss, vision loss, and balance problems. That delays their development and communication. Despite these seemingly surmountable obstacles, children with CHARGE syndrome often far surpass their medical, physical, educational, and social expectations. One of the hidden features of CHARGE syndrome is the determination and strong character of these children. This sweet girl sure is a fighter. This is Molly. This little lady is Zayla, or Zaylee for short. She has transverse myelitis. What is transverse myelitis? It is an inflammation of the spinal cord, the part of the central nervous system that sends impulses from the brain to the nerves in the body. The spinal cord also carries sensory information back to the brain. The term myelitis refers to the inflammation to the spinal cord. Transverse refers to the pattern of the changes in the sensation. There is often a band-like sensation across the trunk of the body with sensory changes below. Symptoms may develop suddenly or over a period of hours or days or weeks, which includes pain, sensory problems, weakness in the legs, and probably the arms, and bladder and bowel issues. Naomi has congenital central hypoventilation syndrome, CCHS. CCHS is a disorder that affects normal breathing. More than 90% of cases of CCHS result from a new mutation in the PHOX2B gene. People with this disorder take shallow breaths. They hypoventilate, especially during sleep, resulting in a shortage of oxygen and a buildup of carbon dioxide in the blood. Ordinarily, the part of the nervous system that controls the involuntary body processes, the automatic nervous system, would react to such an imbalance by stimulating the individual to breathe more deeply or wake up. This nervous system reaction is impaired with people with CCHS. They must be supported with a ventilator to help them breathe or a device that stimulates normal breathing patterns, a phrenic nerve pacemaker. Some affected individuals need support 24 hours a day, while others only need it at night. People with CCHS struggle with temperature regulation, learning difficulties, digestive issues, Hirschsprung's disease, decreased sense of pain, struggle with CO2 regulation, making illness such as the common cold dangerous, heart problems, and many other issues. Hypoxic brain injuries are fairly common with these children. Naomi sustained a hypoxic brain injury at birth. As a result, she has a seizure disorder and low muscle tone. Felix has Menkes syndrome or Menkes disease. Menkes syndrome is caused by a defect in the ATP7A gene. The defect makes it hard for the body to properly distribute or transport copper throughout the body. As a result, the brain and other parts of the body do not get enough copper while it builds up in the small intestine and in the kidneys. Menkes syndrome is a disorder that affects copper levels in the body. It is characterized by sparse, kinky hair, failure to gain weight and grow at an expected rate, which is failure to thrive, a deterioration of the nervous system, low muscle tone, dysphagia, inability to swallow, leading to feeding issues, seizure disorders, neurological pain, brittle bones, mental disabilities, and much more. For some, early treatment may extend their lives and allow some a better chance at gaining skills, but Menkes disease is a fatal disease, even with treatment. Thank you to those families for sharing the story of their children. One thing I do want to mention is the comorbidities that go along with a lot of these diseases. And a lot of times the comorbidities that happen along with the diseases end up being what ends up being the most difficult parts, or the parts that end up taking the children's lives, unfortunately. And I know that that's the situation for a lot of the kids that suffer from these diseases. So we just want to say thank you to the families, and we're fighting with you, and we're thinking about you. And thank you to the Fun family for watching this video. We'll see you later.
All right, thanks for watching.